Schools welcome only grade 12 learners back this week. The Paediatrician Management Group and the South African Paeditric Association together urged government to open schools to all learners and not to allow fear or politics to harm the children of South Africa. Speaking out against government's decision to close public schools again, local paediatricians say that the decision is not based on scientific evidence and the benefits to children of attending school outweigh the risks to both children and the broader community. Professor Mignon McCulloch is the chairperson of the South African Paediatric Association, and she joins us now via Skype for more on this. Professor, a very good evening to you. Thanks for joining us. Welcome.
Thank you, and thank you very much for having me on your show.
Does the Paediatric Association have some sort of scientific data to back its calls to reopen schools?
Yes, so we do. And first, I just need to start off by saying this is really a prickly pear. It's really difficult for parents and for teachers alike. So we really sympathize with them. But at the same time, we very carefully looked at both from a state pediatrician and from a private pediatrician group point of view, looked at all the data, and it's shown that on the whole, children will not get very sick from this condition. They seem to pick it up far less easily than adults. And children on the whole are actually needing their education. Schools don't just provide education, but they also provide a place where they can see their friends. So in terms of mental health, that's a good issue. We're also concerned that these children are actually now in their communities. They're exposed to violence, child abuse. I work at the Red Cross Children's Hospital, and we've seen children being shot by gangsters and shoot, as they get shot incidentally. Children on the pavements being run over by cars, and often sexual abuse as well. And so we're saying if they are careful, and we do strict mask wearing, we do hand sanitizing and social distancing, we feel that it is best for kids to go back to school. We've watched what's happened in Europe and in North America, and on the whole, we've actually found out that children seem to be less affected by this. In our country, you've just mentioned that 10,000 adults have now died, and we've only had 26 children. And so we agree, we think cautiously, a staggered approach, get kids back to school. Many children have only one parent. So in this country, there are 1 million under 6s who do only have one parent, and something like 2 million under 15-year-olds. And so we've opened the economy. We've got parents back to work. And now we're saying, well, we can't just leave kids at home because often there's no one to look after them. So we're saying if we're opening our economy cautiously with the precautions we've mentioned, if you're sick, don't go back to school. But if you're well, you wear your mask, you use your hand sanitizer, and you do your social distancing at school, we feel this is the best thing. Now, you could say, well, a lot of classes are big, 40 or 50 kids. Well, then a lot of the schools have been very innovative. They've said, come to school Monday, Wednesday, Friday, or maybe some kids come to school in the morning and some come in the afternoon. But we think on balance, looking at the data, for kids, best to be back at school. If you do have a family situation where you're fortunate enough to do online teaching or online learning in a safe environment where your parent does not have issues with drug abuse or alcohol abuse, then the parents should be able to choose to keep their kids at home. But we know, sadly, for a lot of our population, the poorer population, the parents are having to go back to work. And so they don't have computers at home. Often they only have a cell phone, or often they don't even have that to do their learning. So we've looked at the evidence and very carefully, we've got nothing to gain by saying get the kids back to school. We just feel that on balance, it's the safest thing for kids to go back to school, possibly get some nutrition. They often get a cup of soup or a slice of bread. Some schools do immunizations, so we know that we're falling far behind on this. And then we also know that a lot of the teenagers are getting depressed by not seeing their friends. So many, many reasons to get the kids back to school.
You just mentioned nutrition, and it is one element of this whole discussion. But then do you get the sense then that the children are capacitated enough to exercise and practice all these safety protocols?
That's a very good question. And we look after a lot of children from very young all the way through to teenagers, and kids are great mimickers. So if you make it fun, You make it into a game. The smaller children put masks onto their dollies or onto their other toys. We've often seen children love to do what their parents do. So if parents are beginning to teach this in a non-stressful environment at home, they make a game out of it, the teachers make a game out of it, children often will copycat exactly what their parents and their teachers are doing. So we're quite confident looking at mask-wearing countries like Korea and Japan. Children are quite capable of wearing masks from an early age, also teaching them basic hand hygiene, and then the social distancing is obviously something that the school as a whole would look at. We also would urge the government, Department of Education, Department of Works, Public Works to work together and ensure that the schools are safer places for these children to go back to. But you actually don't need very much to actually get children back into a school environment, educated, safe, happy, non-depressed children, and often with a meal in their belly before they go home at night.
And there's also concerns, Professor, with regards to the high rise or the high number of infections among teachers. Well, in as much as they may not necessarily be infected at schools, but in the various communities that they live in. But then there is the issue of the risk of exposing the children to COVID-19. And there's also the risk of school infections because many schools lack sufficient water, they lack sufficient toilets and the necessary infrastructure to curb COVID-19. Your thoughts?
Yeah, so we do know that many of the adults actually acquire this infection in their community. So if we're saying let's keep kids at home, send their parents to work in busy taxis, the chances are that the parents are actually going to be picking up infections from each other. And so both in hospitals and at schools, we're saying watch those tea rooms. So when you drop your mask, we call it mask downtime, you have your cup of tea, you have your lunch. That is when often adults will give it to each other. So we are concerned that most of the population are actually getting it in the communities. And so if you say, well, a teacher or a child tests positive at school, it's most likely that they've actually picked it up in the community, at the shopping centre, at the spaza shop, in the mall, in the taxis. So we know this virus is very widespread. And if you practice safe measures in terms of the masks, and if you don't have running water, then the school should try and get some hand sanitizer. But in this way, we actually feel that it can be done safely. You need to be a little bit creative in that you don't get all your kids in one classroom at the same time. You may need to do different breaks. So don't have all the kids running around the playground at the same time, but maybe stagger your classroom breaks as well. But we think with some careful thought, some smart innovation, and some basic measures, we actually are advising that children get back to school. This virus is going to be with us for a long time. It's not just a couple of months. Most of us have reached our peak and are on our way down, but this virus may be with us for another 1 or 2 years. And kids need to be educated, safe and well nourished.
All right, Professor McCulloch, great chatting to you. Thank you so much for your thoughts on this matter.
Great. Thanks a lot. Bye-bye.
All right, that is Professor Mignon McCulloch from the South African Paediatric Association. And we'll leave it there for now. We'll be right back.